You are live. El link te lo mando por WhatsApp. Calma. Ah, no pasa nada, no pasa nada. If you find the icon, you can simply edit the I'm sending you Talita the link.
I will write the email.
Eigentlich der Entertainer for the next half hour. Some of you may know me, my name is Matthias, but I don't know you. So I have prepared a little exercise for you. Would you please all stand up? Would you please all stand up? Yeah, okay. Then I have decorated the corners of this room. I have counted, this is 4 corners, so I have 4 little posters with little, how would I say, statements. And I would like to invite you to select one of these statements that you find controversial, you would like to discuss, and then move to that poster, to that statement, and form a group. And then you all have the skill to introduce you to the other participants. Yeah. The assumption is that you know some of the participants, not all. So you go there and say, hello, I'm Deepak, good morning, I'm from Nepal, where are you from? So you make acquaintance, this is what you can do. And then you try to think about the statements and maybe you can exchange your opinions. Yeah, without judging. And then after a while, I will walk around from corner 1 to corner 4 and interview each group. That's essentially the exercise. Are there questions? Is it clear? Or somebody who didn't understand the assignment? Okay, so you want me to, yeah.
So we go to the statement that is more controversial for us, or the one
You go there where you would like to discuss. Yeah, either pro or con or whatever, but I want to invite a controversial discussion around these topics. That's the idea. If some poster is overloaded with participants, I would go around and say, why don't you go to that poster? Okay? More questions? Then please go. I can read that for you. Corner 1 is indigenous philosophies will make our planet sustainable. Posted, corner 2 is the human race must identify and reject damaging behaviors. And how? The third corner is healthy animals are culled to protect public health. And corner 4 is to protect most vulnerable people, it is necessary to forcibly vaccinate carers. Thank you.
but I think all of you know her already. So it's Katja Radon, who is the chairwoman. She's from the Department of Occupational Health and Environmental Medicine, and she will give a half-hour overview of the CIH and OH target together with a welcome. Thank you so much.
Thank you. So, good afternoon, everyone. Welcome to Munich. You all made it, which is quite impressing me. It also shows me how brave all of you are. I know that for some people it was an adventure. Some people arrived without luggage in the cold Munich. You saw lots of snow. Yeah, but you made it, and it's good that you're here, and I hope that the environment over the next 2 days will be so warm and nice that you're afterwards saying, yeah, it was worthwhile doing it. Well, I'm presenting a bit what has been going on in the Center for International Health for over the last years, and also in our recent project, the One Health Target Project. However, I would feel weird because it's our joint work, and I'm presenting our joint work to you doing the work. So I have prepared some slides, but in between I will always ask you to explain, because you can explain much better what you have done than I could. Okay? So, as you know, we started with a focus on international health in 2009. International health, today, some people might say, how could you start international health? It seems so colonialistic, old-fashioned, and so on. But that's how we started. And we decided to stick to this name because we are the Center for International Health. But our perspectives started to change over time. So the idea was from the beginning to form an interdisciplinary and international network of excellence for development cooperation. Back in 2009, with interdisciplinary, we meant different disciplines of medicine. Also, this has evolved over time. And what did not change, I think, is that our idea was by training to empower health professionals and all professionals around the health field. We started with one big grant given by the German BMZ, and I'm very proud and glad that one member of the German BMZ is here with us today, Caroline Groß. And yeah, with this we started. This grant ended by the end of last year. And we were able to find new grants and to make, like the Center for International Health, I like to compare it to a village with different houses. So we have different projects, different centers all around the world. And there are different projects within this. And what's missing here, I realized last night, Günther, you also were very successful in grant applications over the years. So there are more grants also in the different members of the CIH in our different departments. And the largest share and our largest focus at the moment is the One Health project, OH target, funded by the BMZ and administered through the German Academic Exchange Service. So one help is taking into account that human health is interlinked with animal health and environment health, but we can't see all this separately, and that it's much more than that. That also, as we've seen during the pandemic, health issues affect economy, political things, and vice versa. We have to take into account several disciplines, which is not easy. It's a slow process we have made over the last years to work into this direction. But this is the basic idea behind this. And our idea was in this network to be able to support training and research. As we start from the medical field, still we have a big majority of people from the medical field, and slowly are involving also in other fields and collaborating also with other fields of research. But it's a slow process, but I think it's good that it's slow, because this way we also can make things sustainable. I believe that it's good not to make everything all at once. How is the structure of our regional Center for International Health? Well, we have the General Assembly, and we will have a meeting of the General Assembly on Friday. Then there is a board where I have the pleasure of being the chair, and where we also have the representatives of the other focus areas, and one general representative of the General Assembly, who is Isaias Kibine at this moment, and we'll have new elections on Friday. We have our CIH office, which is crucial, which grew over the years. Things get more and more complex. We do so many things, you do so many things that the administrative part also needed to grow. And then we have the infectious diseases, tropical medicine, and humanitarian aid pillar, headed by Greenhill. The environmental health part, which is headed by me. We have the medical education pillar, headed by Matthias, pediatrics pillar, headed by Florian, and global health, headed by Andrea. And all different people working here in each part in Germany and all around. This is Munich. It's a little piece we have in Munich, and then we have the global network with our competence centers in Bolivia, Ghana, and Nepal, and we have our CIH offices in the different countries, and also the collaborators in even more countries. And with this, we cover Asia, Africa, and Latin America to a certain degree. Which type of activities are we doing? Just a reminder, we do training, we do research, consulting, and outreach activities. With training, the biggest thing. And within the training, we have very different programs running. So we have courses, workshops, certificates, e-learning modules, open for everyone. We offer in different languages as well. Then we have master programs. And then we have the research focused PhD headed by Günther. And so some of our students, like Astrid here, who some of you know, well, they started with the course, taking one course with us. And then eventually entered the master program. Then entered and successfully completed the PhD program and are now professors at universities in the global south. And they're implementing in this case, the more helpful page, but also other fields. So this is like our training pyramid, so having course offers for many, up to the PhD program for a few. And with this, maybe Goethe, you might update us on news of the PhD program. What are the highlights you would like to share with us?
Okay. Yeah, thank you so much. Who recognizes the image? Andreas Kudoma. So he's at the same time not only a graduate of our PhD program, but he's also heading the Competence Center in Ghana. He's an entomologist, so dealing with very small animals, mosquitoes. And this is a part of our advanced module in vector biology and control in Ghana, where we are collecting mosquitoes inside our home. Yeah? So there's a very wonderful course that we have established in one of these meetings, cooperation meetings, in Beira in Mozambique, quite a few years back. We had a module development workshop, and probably Andreas didn't believe it himself, but in the end, this course materialized and it's running since 2018, very successfully so, and I'm very happy about it. So this is continuity, a successful course by one of our alumni, in this case, Andreas Kudom in Ghana. Yeah, okay. Yeah, so, yes, of course, sorry. So it's one second. What else can I say about the PhD program? We started in 2010. We have now the 14th batch, so the 14th batch of students that we have taken in with more than 120 PhD candidates that were enrolled in the program from more than 14 different countries. And this is just one example of continued ongoing cooperation. So the PhD graduates, we had yesterday a very nice alumni meeting of 10 PhD alumni here in Munich. So our graduates are now new supervisors for new students that have taken in. And we have several courses running that were actually developed with our alumni. Deepak is here. Thank you so much. We have a public health course that is running in Nepal, and we have Wahid here with a non-communicable disease course that is running in Bangladesh. Yeah? So this is where you can see, as Katja was just presenting, the course of our PhD candidates. They then leave the program, become professors, they become stakeholders, and then continue to work with us, and we work with them. Yeah? Of course, we are all aware the world doesn't consist only of CIH. You all have your own environments, and we are very happy to also participate in those environments.
You also would like to continue to
Yes. Yeah, about the master's program. The CIH started in 2009. I think the first major activity was really the implementation of the PhD program in 2010 in international health. Why did we implement the PhD program? Because we realized there is a research opportunity gap for our partners in the countries where we were working doing research. But we also realized that there's another gap that is the master's level education. And this is why we then added on a master's program in international health. And this also started in 2018. Yeah? So after a few years, we added the master's program. There's a lot of interaction between PhD candidates and the master candidates. That's, I think, it. Yeah. So thank you so much.
Yeah, thank you. So it will just be a brief snapshot of every program. I think most of you know it a bit, just to refresh our minds, and then starting into the discussions also. So that's the idea. That's why it's so brief and just one photo per program. So I apologize for this. So let's move to the next master program. Andrea, you are going to present us?
Yes, I can update you on the mental health activities, and we a bit expanded our activities for the last 2 years, I can say, from where we started. So we started with a medical education cooperation with the Jimma University, as most of you all know, with the Master of Clinical and Community Mental Health. So this is led by Beza and Mubarak, and we can proudly say, Mubarak, you wrote it 13 alumni are spread over Ethiopia up to now. So this is a story of success, I would say. And so for the last 2 years, we expanded our activities a bit. First, we set a focus away from the adults to children and adolescents. Then we changed our focus a bit for considering bottom-up and community-based approaches instead of only having a top-down thing. And then, of course, we brought in the One House aspect. So we expanded our activities in this regard. So we started with a big One House conference with a focus to children and adolescents in Addis Ababa this year. So topics included were urban green spaces for mental health, for example, or environmental restoration, which can only be reached with mentally healthy individuals who have really an awareness of the interconnection of things. Yeah, so this is where we stand right now.
Thanks a lot. So maybe you can pass to Maria Teresa. I thought you could maybe say a few words about the diploma you're currently developing.
Yeah, I think 2 months ago, we started with a continuous course about to try to reinforce the research skills in the professor and the students of the local university, Universidad San Francisco Javier Chuquisaca in Bolivia. And we have, I think there were many professors and students that take part of this course. And we try to follow all the process of research. So I think it's also a good experience.
Thank you. So now we move to the courses, and here I just have some examples picked out just at random. So the first one would be this advanced module, one of them. So who wants to present? So I guess Deepak.
Okay, so since the time that I was enrolled in the CIH program, we have been talking about formalizing a course that talks about public health system of low and middle income countries and what can be learned from those health systems, so opportunities and challenges. And as we were discussing about this, so I was privileged enough to work with the CIH team to develop this course jointly. So we are running this course on an annual basis. It's a 1-week course. Students are enrolled, so it's a TROPID network accredited course. So there are international participants who can participate as well as Nepali participants, and they can exchange ideas. And the whole objective of the course is to talk about opportunities and challenges of health system in low and middle income countries.
Thanks a lot. Then I think we could pass to Bernarda, who will give us an update on the e-modules.
Yes, so then I think like we were working in CIH with emails a long time ago, but actually it started and it can become stronger during the pandemic because it was really chaotic, the situation, and it was suddenly it was that urgent that the people at the universities were like talking with us and saying, we still need to continue teaching, but how we are going to do it, and now we are in the middle of a pandemic. So then we started with the first course that was pandemic adjustments, infection prevention and control. That we can count this as a successful story because we trained like in Ecuador like 3,500 health workers with this course. I think it was a good success, and it was during the pandemic that it was in 2020. So then we continue with other courses because we are working under the One Health umbrella. So then we started with the One Health core competences course, and then we also have other courses that are important topics regarding under the umbrella of One Health models. They are available for different. We started in English, then we continue with Spanish, Portuguese, and now we have like a variety of courses in different languages, and all of them are available for all the partners universities, and also we share with all other networks that we have in the LMU as UGLO and UGLORIA.
Thank you. Next year, and this I will present tomorrow, the plan is to set up the first certificate program, also as a combination of those courses and other courses. And there is great news from our university regarding your students, but this I will tell you tomorrow. Okay, so then ATTC, who's presenting? Matthias? Marie?
Thank you. Can you hear me?
Yes.
Yeah. So the concept of ATTC, Academic Teacher Training Course, was developed in the good old times before the pandemic, and we were inviting like 20 or 30 or 36 people here to Munich and had a 2 weeks long live training on skills and attitudes and knowledge in medical education. And then when the pandemic came, we converted that to a fully online competency-oriented course with pre-course assignments and a transfer phase and a work and a symposium after a few months later, where people could exchange their experiences with the new teaching methods. The other thing that I would like to briefly explain is the EMIR project.
Which will come later.
Okay.
No, I sorted, so thank you. The idea is really to start from a PhD program, then go into the different programs we have within the CIH, and then other programs. Okay.
I just close here with the ATTC. Unfortunately, the deadline is over, so you may not register for 2024, but most of you who I see here have already participated in that. And we have conducted that in Latin America also, we have conducted in Africa, etc., etc. Thank you very much.
Thank you. So these were the courses. Sorry for not making this clear enough at the beginning. Now come the workshops, and there comes the workshop Andrea already mentioned. You want to add something on the workshop?
I can only add because it was the first conference with the topic of the One Health approach. So this was very new for the mental health experts, I have to say. Maybe it's more obvious for people from tropical medicine, working with mosquitoes or like that. So for us, it was very new, but I can tell you that everybody was like thrilled with that approach, and really bringing in new ideas how mental health can also be integrated in the One Health umbrella. So we made it really interactive, and I was really happy that our CIH office members, my Abbas and Talita Wrights, they were also having really One Health focused workshops with urban gardening. We went out in others, we took a place there, we looked at these places, are they green, are they not green, how is that feeling for mental health? So it was really an outreach activity, and we liked that a lot. We will go on with that approach, of course.
So you can pass over to Günther, who might say something about the momentum.
Yeah. So the Humanitarian Symposium Munich it has started in 2016, I think. So the 9th Humanitarian Symposium is coming up on the 24th of February 2024. The last two ones were on the topics of decolonization and gender-based violence. The next humanitarian symposium is on the topic disabilities in humanitarian crises. Yeah, from all kinds of perspectives. We will also look at disabilities among humanitarian aid workers. Yeah, it's ongoing. It had a small interludium completely online, but now we have come back to in-presence or hybrid. Yeah, it's running well. We have exhibitors, so NGOs that are exhibiting there, and it's a good platform for information for people that are planning or intending to work in the humanitarian field.
Yes, thank you. And we also this year had 2 workshops in Latin America. I would suggest that Denise is presenting, because Maria Teresa already presented a bit from Sucre. Denise, where we had the One Health conference in Curitiba, and maybe you could also say a word about the workshop we had in Sucre, because you also attended.
Okay, thank you. Good morning, everybody. I'm going to just mention that this year we had the opportunity to have a workshop in Universidade Federal do Paraná, with the invitation, with also the participation of the partners from CIH in Latin America. We had mass presence, and our main point was to also identify within the professors and researchers from our university who would be working in the topic of One Health. So it was a very important, because in this topic, many times we are working alone with, and it was, and we have to unite forces and identify partners to develop this team. And also we had a second, I mention the Sucre, Maria Teresa. We had then the second opportunity of Professora Maria Teresa from Bolivia organized the also a workshop on open house in Sucre, Bolivia. And then at this time, all the Latin American universities had the opportunity to visit the University of San Francisco Chuquisaca in Bolivia and to know all the students and postgraduate, not all, but many of the students and postgraduate students and also professors that were also working in this topic, or at least have the wish to join this idea to develop their work. So it was a very profiting year. I think that's it. Thank you.
So you put a lot of work in the interdisciplinary approach at your universities and also engaging self-exchange of students. Thank you. So I think there is another important workshop.
All right. Yeah, we don't have a slide on it, but I would like to have, because we have the representative here. So, Wahid, would you just briefly like to talk about the NCD course with the Bangladesh University of Health Sciences?
Yeah, thank you. After graduated from PhD by CIH, I find a gap that there is not so much talk about non-communicable disease, but I think that there is a double burden, both communicable and non-communicable disease, and even now it's talked about triple burden of disease. Then I proposed a course on the burden of non-communicable disease with collaboration with my local university, Bangladesh University of Health Science, and with Center for International Health. And we have already 2 batches completed online course. This is international course offered. First one as piloting without any fees. But in this year, it was with fee, and we have successfully completed in 3 weeks courses. So hope we will continue this course in future. Thank you.
Thank you.
Thank you.
And then there are the OH target scholarships, and then I'm not sure whether you want to present it, or would you like to hand over the microphone to someone who received the scholarship?
Well, I think many people have received a scholarship. Who has received an OH scholarship in here of the people? Yeah, okay. So, I don't know, Kim, do you want to say something about the scholarship? What did it make a change? What kind of scholarship was it?
So I think it was mainly to support my part of the work that I was doing for my PhD. So I had a very nice concept, but then I realized there was a gap to collect a bit more data. And this data was not collected from the data that I was supposed to use previously. And then I used part of this support. So it was really beneficial in my PhD journey. And I think also there was support for stay during the module block. I think the second module block, we had to apply for that scholarship. Yeah, thank you.
Yeah, thank you so much. I mean, the PhD program is a sandwich program, so the stays in Munich are really short. Otherwise, the research projects are all taking place in the respective home countries. But still, I mean, there are some stays for a few months in Munich, but these are really highly costly. Yeah, so this is not possible without a scholarship. But also during the research periods, some people also to finalize. There's just a financing gap. And we have found that these scholarships, when they are tailored really to the needs of the applicants, can really make a huge difference and help people to finalize. Thank you.
Thank you. for this update. So then we have, of course, also our research projects. The ones currently ongoing within the One Health Network Fund project, where we're very strict that really it is One Health, not taking into account only one discipline, and it has to be international. So currently 4 projects are being done, and I picked out the antibiotic residues in food project because this is the most international one. So Maria Teresa Di Falco is going to present.
Yeah, in the antibiotic resistant in food, we are taking part in Bolivia, Nepal, Ghana, and Italy, and we're working this year, all the year, preparing the instruments and also organizing the capacity building for the next year in the Italy laboratory to assess food, because our local resources are not prepared. So we're going to have this training in Italy.
Thank you very much. So many things, there's already a lot going on. Then, of course, this results in huge networks of our alumni. Just to give you an impression how many countries we cover with that. I also mentioned our outreach activities, which are smaller, but we have this Virtual One Health exhibition, and the course training for that, preparing people to really tell their stories to the public, so to say. Snapshot into our telemedical consultation, where we have the telemedical clinic in Beira. I'm not sure, Kajan, whether you were prepared to say some words about that?
Good afternoon, everyone. So we have a telemedicine project. We started in Beira, then we added Jima University also. So it was twice a month. We had medical doctors, residents from different areas, preparing cases that were difficult to diagnose with local means, and we could be actually required expert opinions. So professors, doctors from LMU were actually supporting, and that really helped a lot, not only the residents, but also to the patients. So it really improved the care. And through that project, we also advanced into having more ultrasound training, cardiac ultrasound training of professors coming from LMU University to Mozambique. And now we've been able to train 15 medical doctors in advanced cardiac ultrasound. So yeah, it's a very interesting project, and of course it's also supporting the bedside teaching in Mozambique. Thank you. Thank you very much.
So this covered more or less what is like at the core of our target of CIH, of our funding at the moment. However, there are more activities. We can't go into detail, but as Matthias already mentioned the EMIR project, I would like to ask you to tell a little bit about that.
Thank you. Well, that arose on the need that those who did their masters, for instance, in the MIC CMH or in the Masters of Health Profession Education or the PhD program, they had hard time in gaining funding for their projects. But once they have graduated, they virtually had no access to funds to go on doing research. And then for us, it was a good opportunity when the Bavarian government issued the call for Bayerisches Afrika-Paket, Bavarian Africa package. Yeah? So that was an opportunity for us to place a project with funds from the Bavarian government to support African doctors and scientists to go on with projects in their respective field. And later it was concentrated on the educational aspect. Everybody was invited, all our master graduates or PhD graduates from Africa, to apply as long as it has an educational component, and people can win relatively small grants for their projects, but for education you don't need as much money as for rocket science. And they also learn to contribute and to build up a scientific community by networking, by supporting each other, by writing reviews on the other people's grant proposals, etc. Thank you very much.
Thank you. So there are many more things going on. I just would like to mention the Cup Wildlife Project, which Maria Teresa already mentioned. Then we are also active within UGLO, within the European University Alliance on Global Health. Günther also is active here, and you saw some of the people. We had lunch together because we finished a conference this afternoon with them before starting this meeting. And we also try to join, forces, and here also to join teaching, online training, so that also your students have the opportunity to collaborate with European students on courses, within the courses on projects and so on. So really trying to broaden perspective. And just one idea also so that you understand why we, as Center for International Health, starting with the global south, I think, why are we now also having a focus on Europe? Well, yeah. The reason for that is that thanks to our work at the Center for International Health, our university management realized, wow, global health, One Health, what they're doing is important for the university. And then they were asked whether they would like to join the European University Alliance. And then they said, yes, we will. Our president said, yes, we will do, but only if it's global health. And this also gives us the opportunity to collaborate closely with the management of LMU, which then in turn also facilitates work. I know the time is already very tough, but I think this is important also to tell, so that you understand why we also have this European network, because I think it's important to bring things together, bring also perspectives together, and also to have the cell phone number of our vice president. Okay, so drop at very important, Günther, I'm sorry for the sake of time, also these aspects. So, and this is not even all we are covering. It just gives us a broad idea about how much work you are all doing and all the fruits you're taking. So thanks a lot for all these efforts. And with this, I would also like to welcome our online participants. We are on the live stream since this presentation. Very warm welcome to all of you who join us today online. And I also would like to welcome Isabel. I'm not sure whether everyone met Isabel, but Isabel is really the one taking good care of all your financial issues. So Isabel, thank you also.
All right. Thank you, Katja. Thank you so much. Well, we are not so bad in time. It is my pleasure to come to the next point and to have an insight into the perspective of the German government. It's my pleasure to welcome Dr. Caroline Probst. She is, I think, a very good example of a One Health specialist. She is by training a veterinary medical doctor, but also an epidemiologist. She is the One Health referent for the German Ministry for Economic Cooperation and Development. Before that, she has been a researcher at the Friedrich Loeffler Institute. And even more so, she's very suitable to be a One Health referent because before attending to animals, I think you were attending to humans. As a registered nurse in the very start of her work life. So she was attending to humans and then later on shifted to animals, and we can discuss during coffee break why you shifted in the end. So thank you so much.
Thank you. Yeah, welcome. I'm on this. Because, thank you for the nice introduction. Indeed, I'm a nurse and I'm a veterinarian, so I care for human and animal beings. living creatures on this planet. And I will actually start with a slide I did not plan to show you, but I will show you because I love the introduction. And we learned in that introduction that it is all about perspectives. And I didn't plan to start with this slide, but if we talk about One Health, we need to be sure that we all talk about the same thing. And I have learned in this short period, in this short introduction today, but also in my day-to-day life at the ministry, that there are many different viewpoints about One Health. But in fact, I love this slide because it shows in one picture what it is about, the One Health approach. On the left side, we see the human being in the center of our attention, and all the other living creatures on the planet, plants, insects, worms, bacteria, but also koalas and elephants around us. And the viewpoint of the One Health approach is that the human being is up there. You can see it in red. It's one little piece of a huge circle called living creatures. So that is the main idea of One Health, and that is what I'm going to talk about, what is doing my ministry in the sense of One Health. So I start with the start again. This is another picture of One Health. You maybe have seen it in the slide of Katja Radon. The idea is to include everything on eye level: human health, animal health, and environmental health. And when we talk about healthy ecosystems, we are talking about a many different topics, including climate, but also including biodiversity. And I mean the basis of our human being life on this planet is 15 centimeters of Mother Earth, including all the microorganisms and all the living creatures we have in the earth, because that's the basis of all our food production. And if you have a handful of earth in your hands, keep in mind you have there more living creatures in your hand than human beings live on this planet. More than 8 billion living creatures. Just to have that in mind when we talk about One Health. I start very basic. In Germany, we have 15 federal ministries, and these are in red the federal ministries which are very closely involved in One Health. You see, it's the Federal Foreign Office, who does mainly humanitarian aid, for example, giving animals to people so they can survive. They don't have to starve, like in difficult situations like earthquakes or floodings. We have the Federal Ministry of Food and Agriculture. All the animal health is situated there, but also plant health. We have the Ministry of Health, obviously, that's the main big ministry, also involved in the pandemic. Then we have the Federal Ministry of the Environment, which plays a crucial role in the One Health context. Then we have the Federal Ministry of Education and Research. This is the one who finances research programs that have a One Health approach also. And the last one is in bold. That's my ministry where I worked since 3 years. Before I was a researcher. And since 3 years, middle in the lockdown, I became a member of this ministry because we put on the agenda the global health and especially pandemic prevention, because we noticed, okay, if we want to prevent the next global crisis in terms of health, we need to go to prevention. And prevention of a pandemic starts much more before human medicine starts. It starts with other fields, with other disciplines, and that's why interdisciplinary health or cooperation is so important. So many different ministries, and we all work together. We come together like yesterday. Yesterday morning, we had a meeting in Berlin where we all come together and exchange our plans in terms of One Health. And I can tell you the main focus at this moment is the International Pandemic Agreement. Maybe you have heard about it, the Pandemic Fund, and of course antibiotic resistances. This is a huge problem which we are seeing and we are trying to tackle. So my Ministry of Economic Cooperation and Development has two bases in Bonn and in Berlin. And we have an additional 130 people that have been seconded to German embassies around the world, in Africa, in South America, and in Asia. So these are some of the challenges we see at our ministry that we are facing, and I don't need to tell you much about it because you all know them and we can read them every day in the newspaper. We are sometimes so tired to hear about the same things like ecosystem destruction, biodiversity loss. And this is a very nice photo, human-animal interface. That I show you that because at the same time that human population is growing on this planet, the number of livestock is growing. It's an exponential growth, and our livestock, our pork, our cattle, and our maybe chicken or other poultry, and the animal-human interface is enormous. From the wildlife-human interface, but also for the livestock-human interface. It's growing because the sheer numbers are growing, so the interface is growing, and therefore the risk of infectious disease transmission is growing as well. So that's a challenge as well. And of course, I don't need to tell you about health infrastructure in the global south in general, but including sometimes here in Germany. We have some problems covering, for example, basic health services, for example, in rural areas. So, and the other thing as global mobility, because I mean, something like infectious diseases, zoonoses, we have them since human beings are on this planet. We had them for millions of years. But the difference is that before, maybe a little village or the diseases were contained to one little village. The big difference in the last 100 years is the increase in mobility. And today we are able as humans to go once around the planet in, say, 24 hours. If we step into an airplane, we are able to transmit infectious diseases within a very, very short period of time, even within the period of time of incubation. So we don't even notice that we are ill, but we have the incubation time. And in that incubation time, we traveled from Munich to Zimbabwe or to Cuba or to Ecuador, and we are able to produce pandemics, whereas 100 years ago, that pandemic would not have been created because it would have stayed at the small village. So that's a huge challenge as well. But we need to focus. Of course, the main aim of my ministry is we put the human being in the center and we try to reach the 17 sustainable goals of the Agenda 2030. Of course, that's our main aim. And we try to cover like air pollution, we try to cover things like recycling of materials, of circular economy. We try to cover things like hygienic and water infrastructure, things like this. We aim to cover all these, but we need to focus. And that's the reason why the BMZ has 6 core topics. These are the 6 core topics with under topics. And you see that we focus on a few ones. 3 of the 3 core topics touch the One Health approach, including food and nutrition security that focuses very much on One Health. Rural development has a lot to do with One Health. Agriculture, climate change mitigation and adaptation has a lot to do with One Health, obviously, biodiversity, forests, water. And this is my the core topic where my department especially focuses on, that is health, pandemics, and One Health, including social protection. Why could someone of you imagine why social protection is so important? I mean, you all know better than me. Why is social protection so crucial for health and for pandemic prevention? Someone wants to add from your perspective? We saw it in a pandemic. If people are ill, they should keep at home. But if they can't afford staying at home, they go to work, they need to work to feed their children, then that's a risk factor, of course. So social protection is a main topic for our ministry as well. And population policy, sexual and reproductive health and rights is essential to my ministry. Indeed, the Ministry of Economic Cooperation and the Foreign Ministry of Foreign Affairs, they both have the feministic policy. I mean, maybe you have heard about it, but feministic policy, I will come back to it later, is a crucial, like an umbrella aim for the 2 German ministries. And you see here that within the huge ministry, we have 6 large departments in the ministry, and 4 of them are involved in One Health. We are divided in either into regions or into thematic topics. And One Health is in a lot of different departments. It is scattered among a lot of different departments. So you don't need to be able to read it just to see how complicated. It's one ministry, only one ministry. We have at least 6 ministries really heavily involved in One Health. So One Health is a lot of work, of cooperation, of coordination, of making deals with each other. And this is the list of countries we mainly work with in the ministry. We have cooperations, direct cooperations with about 65 countries. This list is obviously always subject to control because the political and geopolitical situation changes, and we have to change sometimes a country. For example, in Afghanistan, we don't work with the government anymore because there is no government. But we still work with NGOs, with non-governmental organizations. We don't leave people alone there, but we don't work with the government anymore. So this is the list of the countries we work with. But our ministry does not implement the projects itself, but it has so-called Durchführungsorganisationen that are implementing entities. And I know that some of you, you mentioned the GIZ. The GIZ is the largest one. It's the German Agency for International Cooperation. If you see German governmental workers in your countries, in Ethiopia or Ecuador or Bolivia, then you won't meet anyone from the ministry. You will meet people, colleagues from the GIZ, or from the bank, from the Development Loan Corporation Bank, that is the KfW. This is the one who aids financially. The GIZ makes technical support, like for example, capacity building, and the KfW, the bank, supports financially. For example, the KfW would build a hospital, and then the GIZ would come and would show, for example, people handling the new instruments or handling the new techniques, which are in the hospital. Or KfW would build a school, and then GIZ would come into the school and teach teachers to teach children, or to implement, for example, in the One Health, with a One Health approach, feeding programs for children, including, for example, deworming programs for children. Very important in schools as well. So that is how development cooperation works in Germany. But and very important, we also work together with international organizations and fora. That is, for example, we heard this morning about the European Union, which comes together and brings together universities from many different European countries that cooperate with each other. We, as a ministry, are working on the International Pandemic Agreement, where One Health is a big issue. At the moment, we are having great problems with the negotiations, because there are some countries from the global south that don't want to be, that don't want One Health to be so explicitly mentioned in the agreement for a series of reasons. We will see how that works. We also work very closely together with development banks, including the World Bank. And this is a very important instrument, a financial instrument that they call it Pandemic Fund, which at the moment focuses mainly on laboratories, laboratory equipment, and laboratory capacity building. We also work a lot with the United Nations, for example, also with the UN environmental program. And we work a lot with vertical funds, that is, for example, we heard it before, the Multi-Partner Trust Fund Against Antimicrobial Resistance. That's a very important fund for us. This fund, you know the fund? Have you heard about it? It's a fund that has been created or launched by the tripartite. Do you know the tripartite? I'm going to tell you about the tripartite in a second. But it's just to show you how large the array is in the topics we touch, not only on a bilateral level, working together with specific countries, but also on a multilateral level. You know that we give money to big, large funds, which then go to the countries and fund specific projects or supports in these countries. And these are two fora I want to tell you a little bit more about it, because they are very important for us. One is the Quadripartite Alliance for One Health. That is the successor of the tripartite I just mentioned. And the second one is the One Health High-Level Expert Panel on One Health. Have you ever heard about that? No, I'm going to explain you a little bit about them, just that you have heard them, because they, in the One Health context on a global level, are very important. The first one is the One Health High-Level Expert Panel. That is a consortium of, an international consortium of researchers that have experience in One Health projects. They came together, and the first task they did is to create a definition. What is One Health? And this is the result. And it is, for us, on a political level, very, very important because we always saw that human medicine, environmental, people, everyone had a slightly different notion of what is One Health. And this definition of OLAP now is our reference in all documents, And it's very crucial for us because it really covers everything in the sense of One Health. We always say, you don't need to include the last little plant into One Health for a project to be One Health. But the idea is to include more disciplines, not only one. I say, if you have 2 disciplines, then it's enough. It could be One Health. Okay. So that is very important for us. And the second important definition that OLAP created, which is very, very important for us, is the term prevention. What is prevention? Because for some people, prevention starts in a laboratory, or prevention starts when a vaccine is created. But in the sense of spillover prevention, prevention is much more, or takes place much more before something happens. If you touch a dog or get bitten by a dog, prevention is that this dog is vaccinated against rabies, or that the dog has no rabies. That is prevention for us. It starts very, very at the beginning. Or prevention, let's take an example of purely human medicine. If you prevent people from smoking by telling them, by teaching them, be careful, smoking is not healthy for yourself, for your children, that is prevention. Prevention is not, I'm going to treat well or to have a good method of surgery to heal a person. And that is the idea of spillover prevention. We start at the very beginning. For example, biosecurity and animal holdings is a very no problem. For us veterinarians, prevention starts in animal holdings. Wearing gloves is prevention. Wearing boots or wearing a special suit if you handle animals. Or cooking meat, not eating raw food. These things are for us prevention. They are very, very important. And they have a lot to do with social sciences. For example, why do people behave like they behave? We have that in the context of wildlife, for example, hunting of wildlife. Why do people go to the forests and hunt? How do they hunt? What can we support, or how can we support so they wear, for example, gloves when cutting meat? They wear special gloves so they don't cut themselves, things like that. That is prevention, and prevention usually is much more cheaper than going to the laboratory and doing sequencing or genomics. No, that prevention, and that is a very important definition as well. So OLAP helps us with definitions. It helps us with the definition. What is One Health and what is prevention in the sense of deep prevention or primary prevention? There are so many different terms out there. But important is that understanding that prevention does not start at the laboratory, but prevention can start much, much before. That's the idea behind it. And the other very important fora with us, for us in the context of One Health is the so-called quadripartite. The quadripartite is a cooperation between the 4 largest, or 4 big international organizations, that is the WHO, the WOA, which is the World Organization for Animal Health, the FAO, the Food and Agriculture Organization, and UNICEF, which is the UN program for the environment. They came together, and the tripartite, that was the old one. Until March 22, there was only the tripartite, these three organizations. And in 2022, the UNEP came. They joined the tripartite, and therefore they became the quadripartite from 3 to 4, because the insight was, okay, if we want to really sustainable improve human health, we don't only need to include animal health, but we need to include even more of an environment. If we live in an environment where air pollution or contaminated water or the earth is not healthy anymore, in such an environment, people cannot survive. It's a basic of our life. So we need to include the environment. So that was the reason why UNEP joined the tripartite, and so it became the quadripartite. And the quadripartite for us in the ministry is a crucial cooperation partner. They developed a joint plan of action that is just the working program. And now at the COP28 in Dubai, the implementation guide about how can this joint plan of action on One Health can really be implemented. Because we are talking about a lot about how we're coming together. And it helps, it's just a help to support countries to really implement One Health projects. So sooner or later, you will probably hear about the quadripartite, you will hear about the joint plan of action on One Health, and these are the things we are doing. And I brought you an example how we cooperate with the quadripartite. We had in October this year a very nice event in Berlin, an international event that was called Breaking Barriers, Advancing the One Health Agenda with a Focus on Environment. And it was a nice event because people came together, they drink coffee together, and they just, we were talking about topics they never heard about. For example, we brought together the public health community and the environmental community. And the environmental community, the biologists, the entomologists, they talked about earth and insects and about biodiversity in wildlife. And medical doctors, they find it very interesting. I mean, it's just that they don't have it in their curriculum. And then we come back to education and to university education as well. So it is so important to include these ideas. It's just ideas and interactions and getting to know each other. With each other, I mean different disciplines. To include that already in the schools and in university, to teach students, hey, you are studying, for example, human medicine or social sciences or veterinary medicine or biologist. That's super, but you need to be aware that there are colleagues outside there you will maybe have to collaborate in your later life with. So get to know each other. And the ideas and the definitions of terms and the approaches. So that is really important, and that's also something we do at the ministry, bring together different communities and get them to talk together, bring about ideas, and then we can listen and say, okay, that idea, I like it, we're going to fund it. So I'm going to bring another few examples because similarly to the center where today we cover a lot of different topics, but I want to draw your attention, for example, to a very nice project we foster, that's the performance of veterinary services. That's an instrument that the World Organization for Animal Health offers to countries. I hope this comes back.
Comes back.
Okay, it usually comes back. So, you know, veterinary services, humans are also nomadic, but veterinary services on national level are very, very complex systems. And they have a lot of human resources, material resources. They need to implement a lot of regulations. We have a lot of regulations in animal health. You would not believe it because we don't have that in public health. For example, if we have a new outbreak of an infectious disease, we have to notify it to WOA within 24 hours. If it's not a new outbreak, but an older outbreak, we have to notify it within 1 week. So we have huge regulatory issues. And the WOA just offers like a project that goes into the country, a small group of people come to the country and look at the veterinary services, how can they improve it, and do they spend the money in an efficient way. And this is a service which is crucial in pandemic prevention, for example. So we promote that. Another thing that we promote is the photo of the chicken here. That was a public demonstration from animal holders. They had an outbreak of avian influenza, and we saw it in the corner 3. The question was, healthy animals are killed to protect public health. That is what happens when you have an outbreak of avian influenza, that you kill all the animals of one farm, or one holder of all the village. You can happen to kill 100,000 healthy animals to stop the infection spreading. So what happens in Germany is the animal holders, they get compensation, but obviously in many other countries they don't get compensation. And the problem we observe then is, of course, if you are an animal holder and you have 20 chicken at your home and you see the first one died and the second is not staying, it's ill, then you won't say, hi, my animals are ill, please kill them. You won't do that. You will try to slaughter all the animals and then sell the meat, and then we have a spread of the infection. Wow. So to prevent that, we want to implement not only social security for people, but also social security or animal security for animals. Because then we want to reach the situation that animal holders are, say, okay, I have a problem with my animals. Okay, as I get compensation, I don't have any problem with telling the truth. That is what would be the aim. So we are looking at these things. We are looking at the animal environmental human interface, because a lot of people, especially children, they share a common environment with livestock, for example. If in this river or in this water the cow pools in and the child has a bath later, then the risk of infection of many different protozoa and bacteria and viruses is obviously enormous. So we look at that, and of course we look at the hygienic infrastructure. We try to improve in general health infrastructure, hygienic infrastructure as well. We have very nice wash programs or fit for school programs which show children just to wash hands, a very basic thing that doesn't cost a lot of money, but very effective. And what we do, I have mentioned it before, we have a close look and a special focus on women and girls. Why? Because they play a crucial role in One Health. It's women who teach children to take basic hygienic measures, to wash their hands, don't kiss the dog, don't kiss the fork. These are women and girls, of course. We teach them they have rights and they have the possibility to take part and to say, okay, I want to be independent. A lot of women are there, take care of animals, so we want to teach especially women and girls. So another big focus of our department are neglected tropical diseases. We have a huge project regarding rabies, especially in Cameroon and in Namibia, but also in Cambodia, for example, in Vietnam. And we also foster or we finance multilateral organizations, NGOs or the BOA that have eradication programs on rabies, but also on other neglected tropical diseases. In Kenya, we have financed the so-called One Health Research and Education Center. Maybe you, is there anybody from Kenya? No, okay. But we have cooperated with it. Are you from Kenya?
Yes, I am from Kenya.
Do you know Oreka?
Yeah, we've tried to do some work with them.
So they are a great cooperation partner. Maybe you have the opportunity to cooperate with them. I don't know. They do a lot of things. They do from antimicrobial resistances to PPR, to pest of Petit Cruminals, the Rift Valley fever, food security. They do almost anything, and they do a lot of education. They have a lot of education programs that very good. So we foster them. We don't only foster ILD with Oreka, we finance also specific projects. For example, the BUILD project, which looks at small ruminants, goats and sheep. So we have these. We finance projects in the ECOWAS region. We finance food safety projects in Tunisia and in North Africa. As I already mentioned, the rabies eradication program, we are fostering with financing with 10 million euros. That's a new project. And we also look a lot on the topic of digitization. We try to bring together data from human medicine, animal medicine, and environmental data, weather, climate, water, rates of destruction of forests, because that's a big issue and a big risk factor for the animal-human interface, for rodents, for insects, for bats, especially. So we have to look at the digitization. We try to improve the surveillance networks, especially, for example, that's only an example, SWOT. You have maybe heard about it? The device SWOT, no? It's just, you can use it in your mobile telephone, and it brings together like hospitals, medical doctors, but also veterinarians, airport physicians. It's like a platform where everybody can look what is going on. Is there something out there which I have to have a look at? That's another example where we implement the One Health approach. That is the so-called ZIG, the German Epidemic Preparedness Team. That's a small group of especially laboratory experts like microbiologists, but also veterinarians who go to countries who apply they can apply, countries can apply and say, we have a problem here, for example, with Ebola or with any other disease, especially right now we have dengue fever and avian influenza. These are the two where we have currently some support going on. And they go to the country and do, for example, capacity building for sequencing or things like that. Another example, and this is a little bit more beyond our traditional thinking of health, is if we protect biodiversity, we protect our health at the end. So that's why, for example, projects like the Legacy Landscapes Funds, which provide sustainable financing of protecting nature, they count indeed like preventive measures for protecting human health at the end. And a very important project as well is the International Alliance Against Health Risks in Wildlife Trade, which has a good, you know it maybe, yeah, from Maya, Bolivia, Ecuador.
Well, we are having a project in the
Yeah,
so she's the leader of the project.
I'm happy to hear that because I love it, because I hope so, as far as I know, they have a very preventive approach in the sense of they try to understand human behaviors, and they try in the global north to increase sensibility. Why do we need products of wild animals in these dimensions? It's a luxury usually. For us, it's a luxury. We don't need to consume products from wildlife. So it is a very preventive approach, and therefore I think a very good and important project as well. Yeah, I'm finished. That's only an overview. It's an older overview between 2016 and 21. What I just wanted to show you is that our focus is in Africa. We do projects in the Central and South America. We do projects in Asia, but the focus traditionally of our ministry, and Germany does almost 70 years of economic cooperation, it lies in Africa, has always lied in Africa. So that you know this slide, I show you the slide again. It's the One Health approach in a nutshell, from a human perspective and from nature perspective. And we already talked about your perspective, but maybe we can discuss again. And if you have questions, please feel free. I'm here.
Do we have questions? I think we have time for 2 or 3 questions. Any questions?
Or suggestions?
Yeah, Katja.
So I hope I didn't explain why I have to leave the room for some minutes. But I would be, thank you very much for this comprehensive overview. I would be interested what measures you take to overcome the interdisciplinary challenges of the ministry.
It's about drinking coffee, having lunch together, having meetings together, communication, and getting to know each other personally. And I mean, these virtual conferences, they are very helpful if we cannot assist in person, but being here and having a dialogue, getting to know each other is very important, especially across disciplines. And the other thing I would say is if we have the possibility to, as I said, to include the approach into university, into education, not to tell students, because you study this discipline, whatever it is, you are more important or you are wiser than the others. No, you need the others because in our work we get to specialize more and more and more, and at the end we are specialists on sequencing on sequencing some samples, but we don't know the background, and we need to come back to other disciplines and cooperate with them. So start at the very beginning to teach students. You concentrate on your study, that's fair enough, but don't lose contact to the others. Yeah, what you do, that is the important thing. Yeah. And that is what we try as a ministry. We come together. I mean, as I said yesterday morning, it was very important for me to be in Berlin, even if I saw the train maybe not coming here. So, but it is important to keep in touch with the other ministries, to talk together and to keep in touch. It's what we do to overcome these things.
While I give the microphone to Ursula, do we have questions from the people attending online? Does anyone have an overview of the online participants?
I just wanted to comment on the slide 2 with the ministries you showed. I was astonished that not more other ministries were also involved in discussing about One Health, like urban development, for example, or many others.
That was not fair of me. This is, of course, other ministries are involved as well, no doubt. It's the main ministries. It's the main ministries that are mainly involved. But you are completely right. If we talk, for example, about how the city of the future is going to be built, green gardening, like these climate change mitigation topics, they are crucial for the Ministry of
The first one, climate action, and then the last one, the Ministry of Mountains and
yeah, the last one, correct, yeah, of course, and they are all involved. That is correct, but it is not the primary ministries where they are always and always, the cooperation is closer with these ministries, but you are right, of course, even the other ones are also, even, for example, the Ministry of Defense, you would not believe it, but with climate change, the risk of infectious diseases, vector-borne infectious diseases rises, and that's essential for the Ministry of Defense, which has soldiers in the countries where these diseases are present. So they are all involved, but these are only the main ministries. You are right.
Do you have any questions from the online participants? No, nothing? Okay. Another final question? Yes.
Yeah, it was new for me that the concept of One Health was expanded in the quadripartite. Is that what we consider planetary health?
No. Katja Radon asked me to not to go into these definition things because the definitions, they are not consent definitions. We have a consent with the One Health definition, but not with the other ones. There are so many: planetary health, global health, one medicine, many different definitions. And the thing is, I think the important thing is we should come together across disciplinary borders. That is maybe one of the main issues. But planetary health does not consider so much like the very, very beginning of, they won't talk so much about biodiversity in invertebrates. They would rather look at the, for example, economic aspects, about the political aspects, about the social aspects, much more on a global level. That's a difference. And you said, which health, planetary health, still puts the human being in the center, whereas One Health sees the human being as part of nature. That's, I think, the main difference, if you want to say it in one sentence. Okay.
Thank you for a very comprehensive presentation. You presented mostly from the perspective of your country or this country, Germany's. And when you compare yourself with the counterpart from other countries like France or Italy or UK, US, where do you see BMZ standing in terms of your position on One Health compared to other countries?
That's a very interesting question. I know that Germany is still one of the largest money givers in this field, including the One Health approach. So, for example, for NTDs, where we have a very essential One Health approach, the United Kingdom was a very important player, but I think it was 1 year ago they stopped financing NTDs. So we are now, even in the field of entities, one of the largest donors. And I think the One Health approach is much more developed in the global south than it is in the global north. I see many countries in Africa that have a One Health strategy, and I don't know even one single country in the European Union that has a One Health strategy. So we are learning from our partners in the Global South at the moment in this field. Yeah. It's like that. And I hope that we keep on going with One Health, because with the new geostrategic situation in the world, we are seeing, sadly enough, that funds are going back in this field. With the war in Ukraine and in other parts of the world, we have to deal with big financial cut downs at the moment, very big ones, and one of the cut downs directly affects health, pandemic prevention, and including One Health. And that's very, very sad, but that's at the moment the situation.
I was planning to not dare to ask this question, but now you touched it. Can you be a bit more precise about what we have to expect in terms of the financial situation for the projects in the near future? So you said we have to expect cuts. Can you give us a little insight into what is happening politically to this field? Because we are all working together and we are, of course, dependent on funding also from the government side. Could you just give us a brief insight into that?
You forced me to end with a negative, but it is like it is. Yeah, I can be sincere and say we are. I was just looking at my emails, and it is like that. We have to count with it. We have very serious cutouts, and we have to tell our colleagues, for example, in the GIZ, where we know that personal decisions are being made, and people, young people, very, very excellent colleagues, will have to leave and search for new jobs because we're really having a very severe cutdowns. Not for projects that are that have been already given green light, but not for new projects. For new projects in the field of health, it's 2024 very, very, very difficult. Yeah, it's like that. It's not only my ministry, it's the whole country, and it's the whole situation worldwide. I mean, we have several crises, and we have issues that are difficult to solve, including with the pandemic agreement. It was their chance to do a pandemic agreement, but we see like big players that don't want to have it.
Thank you so much. That was really an excellent insight into the government perspective. I think Ms. Probst is still around for questions. You will have to earn your coffee break. We will postpone a bit the coffee break. We will first all move out, and please all, now, don't chit-chat and stay somewhere. Please, everyone, now, move to the hall of the university, the main hall, where the big staircase is. We will meet there for a photograph, okay? So the faster you go now, the faster you will then get to coffee. On Okay, let's continue. Let's continue, please. Okay, so I hope you had a good coffee break and maybe one or the other had a brief look at the posters. We are not having hiccups only with the weather, but also with something that is ravaging us since a few years, that is COVID. We had representatives of the German Academic Exchange Service that were supposed to talk to us about their viewpoint on the strategy. As you may know, the German Ministry for Economic Cooperation and Development is not brokering the funds directly, but via the German Academic Exchange Service. But the two reference, they got COVID, so they can't come, and apparently they're really sick, so they can't even offer the input online. And so Katja, happily, she received materials from the colleagues from the DAAD, and Katja will give us a brief introduction on the DAAD perspective. Thank you.
Thank you, Günther. So I will try my best, yeah? It's not my slides, it's not my topic. I will try my best. So, because, as you know, what I'm doing is some research here, some project there, and everything. So what I learned from this is to improvise and try to show up as an expert, even if I'm not in depth in that field. So the colleagues from the DAAD sent me this presentation last night with this structure about DAAD, about EXCEED funding program, and the EXCEED perspective. Now, before I dive into this, who knows what the DAAD is? Who does not know what the DAAD is? Okay, so hopefully, yeah, so here, just some words. It seems that the DAAD is the world's largest funding organization for international exchange. It's an independent organization of the German Higher Education Institution and their student bodies, devoted to internationalization of the academic system. It's and it works between the ministries and the universities. Some numbers to, I don't know, impress maybe. I think it's impressive what DAAD does. All the people working in different countries across the world. You have DAAD office in many of your countries, also you might know. Then also the individual scholarships they are giving directly to people. So I couldn't have done my master's in epidemiology at McGill University in Canada without an individual scholarship of DAAD. But other than that, they also have projects. They also provide larger projects like the EXCEED program, within which we then again have individual scholarships, but also other projects. What is relatively new, and I think it's also a German government perspective, is that it's so important to also support women, to have gender equity, and so on. So they are bored of that in 2022, women comprised more than half of the DAAD's funding recipients, and I think that this is something we in Germany at least see many levels at the university. When you go into our medical faculty, they're almost, well, the majority are women studying medicine. Where does the money of the DAAD come from? So and you heard some of these names before in the previous presentation. They come from the Federal Foreign Office, the Federal Ministry of Education and Research, European Union, and also the ministry of which we just heard before the coffee break, the Federal Ministry for Economic Cooperation and Development, the BMZ, and they are also the funders for our EXCEED program. So the headquarters of the EAD are based in Bonn and Berlin in Germany, but they have 57 DAD offices worldwide, including information centers and regional offices. And usually in these offices, they also provide German classes. Then there are 6 German centers for research and innovation. And they have these lectureship programs also for German studies teachers. You see the worldwide distribution of the regional offices. However, they were also struck by cutting down resources. For example, there was an office in Lima in Peru, which now no longer exists, and I'm sure there are other examples. So this as a background, DAD as a big funding institution, not only for individual scholarships, but also for other projects. They are, for example, also funding this in this European network, which I already briefly mentioned. Also, they are funding their top-up funds for the German universities. But they also have larger programs like the EXCEED program, which you all know, which are networks of higher education institutions from German universities and their partner universities in the global south. And they're thought to be an excellent center for exchange and development. They started in 2009. And we, in this funding phase, we won already with the Center for International Health, which was then funded until 2022. And then there was a new call for new projects. So we could, in 29, we could not apply with the same project, but we had to come up with something different, at which time we came up with the OH Target project. So the idea is that German universities should have gained expertise in development cooperation. So a bit like at the same time we have these excellence initiatives, excellence in internationalization, always with more a focus on German universities collaborating with the US, for example, and so on. But here the expertise should also go into development cooperation. But also with the idea to involve non-academic actors and to focus on research priorities related to the Agenda for Sustainable Development. And then, of course, training people. These people should also be able to get a job in the local job market and hopefully also stay in their home countries. So, so the idea is these networks, knowledge transfer, multi-stakeholder partnerships, research projects, different types of study programs to be offered. And also this was at this time when we applied for OH Target that also technology is being used, and also to focus a bit more on e-learning to reduce the number of travel, which should be done, which is interesting because the call was in 2019, and then in 2020 we couldn't travel anymore. So, and here you also see why, one of the reasons why we thought or we have developed these online modules also, yeah, because it's also within this call. So, yes, these were the former networks. Here you see the Center for International Health. These were 5 networks. So here, and these are now the new networks, of which we again are one, the OH target. Then there is one in Kassel. The University of Kassel already had a project in the former funding phase, and the same faculty also started with a new project to strengthen the capacity of partner universities to address global challenges. Then close to Kassel is Gießen, the SDG Nexus network is there. Then we have in Berlin one center, in Leipzig, in Frankfurt, and here at our sister university in Munich, the TUM, there is the SEED project, more focusing on engineering aspects. Well, it's the technical universities. They are having a parallel meeting, and they even invited us tomorrow for dinner if we like to join. So yes, there is also a lot going on in all these other centers. So here you see some of the topics: employability, addiction, sustainable urbanization, partnerships for sustainable development, One Health and entrepreneurship. So you also can see immediately, recognize immediately that it has something to do with the SDGs. This program was currently reviewed, and I think we bothered you with some questions. So what was evaluated was not the single project, but the whole program, with the idea, with the question on whether these projects are worthwhile spending money on or not. Yeah? So the whole idea of these exceed centers and so on, are they worthwhile to be continued or not? And this was based on the reports of the previous years. I'm emphasizing this so much because I know that these reports cause a lot of pain. Not only to our office, also to you. And you have to contribute, you have to report, and you have to count your students and so on. And I know that sometimes it's annoying. But it's important. Because it's really looked at. And based on this, this was like a trial, whether they could do the review just by looking at reports and some additional questions. And the conclusion of this was, yes, it's worthwhile doing it that way. This means that our reports will stay a very important part. I'm just announcing this because in February we have to submit the next report. And we will bother you with this report. So I ask you to please not be annoyed, but to understand that we really need they're good for something, they're very important. So based on this review, in the whole program, 106 curriculum modules and courses were developed or revised, 60% of which are online or blended learning, which was one of the objectives. So most of these courses were offered in the third funding year. This is something we also learned. Things take time. You can't start with something right at the beginning. And around 500 participants were on these training courses, if I get it right, but this can't be done. I guess I understand this one. 62 trainings on third-party funding acquisition, 460 participants. This can't be because we have more than that. So it can't be the whole network. So I'm sorry, I'm not able to interpret this number. Yeah, but there were 260 training events with almost 14,000 participants over this time. Scholarships for master students, PhD students, and for postdocs. Here you see the numbers for 2022 in the whole program. Another focus of the program was problem-based training. So important for Matthias, also for Matthias and for many of us. So about 2,500 teachers were trained in problem-based learning methods. And in ICT-based methods, it was around 800 staff members being trained in that. So the evaluation had to respond to the question, how is the program as a whole to develop policy and for the target group, and how efficient it is. And the conclusion here were the EXCEED program has relevance for development policy and is in line with the objectives of the German Development Cooperation. So, check mark. It has a high importance for target groups, participating universities in the partner countries, scientists at different qualification levels, and students. Another check mark. And the results achieved so far are in good balance with the resources used. So it's also efficient, the program. This was it's the result of the evaluation. Now, what about effectiveness and achievement of goals? The funding instruments seem to be appropriate in relation to background of the intended objectives and the target groups. The status of the achievement of targets at program levels is on time. At the project level, it was also possible to determine that targets were largely achieved on time without major deviations from the planning. And this despite the pandemic. There's room for improvement with regard to program monitoring. The monitoring tool DAD is offering also the reports, things like that, things we all face every day. Well, not only we realize it, but also the evaluators. So, which I think for us is also good because this means that there might also be changes implemented in this. Then the other question was, what about sustainability? As you remember, the CIH grant was ending in 2019, and then we had this prolongation, this transfer period until the end of last year of the CIH program. And it was evaluated whether this is worthwhile doing as a transfer period towards sustainability. And the conclusion was that this was good to do, that it was helpful for the projects to have this transfer component, that it increased sustainability, and also helped the new networks, those who were at which universities before there was not such EXCEED program, to develop the program because of a collaboration. What is a critical point, or was seen critically in the evaluation, is how much knowledge was transferred from the universities to the practice of development cooperation. So there, evaluators found that the centers were lagging behind, or the program was lagging behind. So when DAD is now applying to BMZ for other funds starting for 2025, and of course we just heard that it might be difficult, but DAD will apply based on these results for another funding period, during which we can also extend our project. This most likely will be something we are asked to improve, also within our project. The transfer into practice. Just that you have heard about that, also when we are doing the workshop tomorrow, that we also need to think about this, how to put things into the practice of development cooperation. Yes, and then also that we always have to think about sustainability, where to how to make our project sustainable. And I already told you, and you know, and we all work on that this is the reason why we also include other projects, apply for other funds and so on, in order to make what we are doing sustainable. The other aspect is gender equality. They said, well, it's within the project, it seems to be reached. However, it's not monitored well by the EAD. And then in some of the networks, all these points doesn't necessarily apply to our network because it's our evaluation. There might be room for improvement in the participation of white scientists at earlier academic qualification level. I'm not sure, I can't see this, but maybe I'm also blind there in this aspect. So the overall recommendation was, yes, prolong the concept, strengthen the transfer line and its input to development cooperation. Also, that the way it's thought of could be expanded to other DAAD program. Also, improvement of the success indicators, improvement of results-oriented monitoring. So the monitoring again, the sustainability I already mentioned, and yeah, so and the dissemination of the lessons learned from this type of evaluation which was done. So these are the slides I got from the AED. Sorry for not presenting them so fluently and deeply. I'm sure the colleagues from the AED would have done much better. What's missing here is like an outlook. How will it be? How is it planned at the AED? What I know from the last meeting of the Exceed centers, we meet every second or third month in an online meeting. There, DAD said, colleagues from DAD mentioned, okay, that they are based on these results, they now can apply for a further funding period, taking into account these recommendations, and that they will apply so that hopefully there will be a call for the existing centers for these 5 ones, including OH target, coming up maybe in April next year, with an application deadline by the end of June. And then in September, hopefully, the announcement of the result. However, we can't say 100% that this call will be coming, given the shortages we heard in the previous session, because money comes from the German government, from the BM side, and of course the shortages affect several programs. At the time I got this information, which was in a month ago, there it still said, well, that they are very optimistic because of the very good evaluation results and that the importance of this network is really seen at the governmental level, but things change every day. So thank you. And if there are questions, I try to answer them or ask the colleagues at DAD once they are back to work. Thank you. Questions?
Thank you for the presentation. Only because I think the next year we have to maybe work filling some gaps of the OH target because we have to achieve some results and outputs. So in general, our network OH target project, maybe in which aspects or which results we need to work deeply.
This information was not given. I think this is something we should evaluate very critically in our workshop. That's one idea, that we also have a look at SWOT analysis, that we look at our network, first having our point of view, and then later on maybe also look at what the funders want to have. But I think we should be very critical, think about, okay, and we have many strengths, we know that. But everything which has strength also has weaknesses, which is obvious. We should be very frank about that, evaluate this together, this is part of the workshop, and then think about, well, about how to continue from this, how to improve, and also looking at funding opportunities also beyond the program. Because with this program, also when we continue, we can cover part of our ideas and costs, but not everything can be covered by that. So I think this is also crucial, that we are open-minded to other possibilities of funding, as we already did in the past. But yeah, I think this is a very important objective of this meeting, to really discuss, be open, and tell things, and not hide, and then in the end, the evaluators will recognize our weaknesses. So it's better if we ourselves can identify them and improve on them. Everyone's frustrated, tired, hungry. Yes.
Thank you. I think the presentation is very good, and the achievement in different aspects are, very well, as far as I understood. But as I understood, I think the fund for CIH comes from a limited source of sources. So, are you considering to have a diversified source of funding, so that there will be, different contributions from different sources?
Yes, exactly. So we have the OH Target project, which at the moment is funding, well, the back training and research aspects of One Health. And other than that, Günther was very successful in obtaining funds also for the alumni network, for the PhD program. Outside this, we also have the funds from UGLO coming into the CIH to fund additional aspects, which are then also useful for the CIH, for you, the partners in the Global South. Then we have research projects like the Cup Wildlife Project, which is part of also the Alliance Against Health Risk of Wildlife Trade. It's so long I never can remember. So where we are members, where Maria Teresa won a project which is currently carried out in 4 Latin American countries. On this aspect, then Matthias was successful. Here he is at the ministerial level with the AMIA project. So yes, this absolutely is the plan. And the idea also of our conversations over the next 2 days is to think about and also join our knowledge about which funds might be available. I think today we also heard some funds which might be worthwhile looking at. At the moment, there are new funding opportunities coming up for specific continents also. So this is another aspect where we also not everything has to be for every part of CIH. Yes, exactly. And I think, yeah, that's the way to go. And that's also, I never thought like that, but for DAD, this also means sustainability, not to rely on only one fund.
Because I'm totally new to this. When you said there is coming up funds from the DID for other continents, for specific continents, it's possible to have additional DID money plus the DID exceed money.
Yeah, well, sorry, I said DAD, it's BMBF, so the other ministry. Yes, so we can't do double funding. So it's not possible to fund the same activity. But for example, within the network, we can carry out new research projects or have new programs at specific universities or in Latin America, for example, in Africa, with this additional money. And what I say, and I think this is also correct, when, for example, we develop within UCLO, we are now developing this certificate program on global health, which has strong components in One Health in it. And this certificate program, of course, we don't only open this for our UCLO partner universities, but also for all partners of the CIH network, of all of your students, because otherwise I think it doesn't make sense. Yeah. At the same time, when we develop a module here, I wouldn't restrict it just to CIH partners, because why are we developing these teaching tools and modules? It's to train people and not to restrict ourselves to 1, 2, 3 specific partners. So I think all this helps us to have a comprehensive approach, training approach towards One Health. More or less.
Yes, and the additional money that is not from the DAD, but from non-ministry.
Yes.
Okay.
But I mean, it can come from DAD. Yeah? I mean, what we have received now, I think what you refer to is the EPOS program, which is scholarship funding for international health programs. So we secured a 7-year funding for PhD scholarships, and that's coming from DAD. So that's not a problem. You can have 3, 4, 5 funding packages from the same entity, DAD in this case, as long as you don't double or triple pay the same thing. Yeah, I mean, I think that's obvious because that would be a fraudulent action. But I think the important thing about this is that also we have here many experts now in this room that used to be PhD candidates. I think this is also a very important exercise to not think there is CIH as this huge temple of knowledge exchange and funding, but to really also learning that all of us have to engage in finding additional risk stratification methods, because this is what it is about, it's risk stratification. Yeah? So we have to look for other opportunities. All of you are in different networks. Yeah? So are we. I can take any one of our advanced modules and lay out in how many different networks actually we are advertising this course. Yeah? When we are talking about the advanced module in Ghana on the mosquitoes, it is not only CIH, yeah? It is Tropin accredited, there are external participants, there can be medical undergraduate students even participating. And this is something I think also very important for you, and I think we are very open also to learn from you if you are a member in another network to say, look, you have this module, or we have together developed the module, the one that we designed yesterday, for example. I'm extremely happy if you say, look, I'm a part of this network here. Could we also incorporate this module there in that additional network? Because they may be paying for, or may have some or the other benefit. Could be a lecturer, it could be expertise, but of course it could also be a monetary benefit. Yeah, I think this is a very important joint learning exercise for us. Yeah, and I think we would like you to really go out of this cooperation meeting also with the spirit. Okay, so how can we use in multiple ways what we are doing, also in other networks, in order to maintain what we are doing, because we hope that this fourth exceed funding period, or however you want to call it, 2025 to 2029, then that this will work out. But if it doesn't work out, it's not the end of the story. Yeah, CIH will continue and our activities will continue, but the funding mechanisms may be completely different. Some things that we do may maybe become less important, or maybe we will decide, okay, we'll discontinue, and maybe we'll have to put a different focus, like now with the One Health topic. So please, keep up this really creative mind in finding alternative solutions. Yeah.
Maybe just to complement before Wolfgang is continuing, just to complement. I think what we learned here, and what the big advantage really is a bit the infrastructure, how to run such projects. Yes, this is what we learned. You set up this PhD program, which is excellent and of which all of us benefit a lot. And we have you, the network, working together. You know each other. You have a lot of experience, and you come out of this experience. So this is the basis. This is the platform. And now it's in a way, risk stratification. It's you. We are the network. You are the network coming up with new ideas, which we then can put into place in the future.
Yeah, I think I don't need it. I can speak like this. Can you all understand me?
It's just for the online audience.
Okay, I forgot that. Okay, yeah. Well, okay, so I have to speak a little bit less loud. Okay, from my experience, there are in your own countries, of course, funding is possible. We are concentrating at the moment too much on Munich, the DAAD and so on. From my experience, there are funding agencies in your countries. And what I think is it makes sense, South-South cooperation. For example, India, Tanzania, just to give an example. And you look into funds in your own countries. That was just a comment I wanted to make.
Comments. We have 2 more days.
Yes, many more things to discuss.
The closing.
The closing. Should I just? I would give instructions for the evening.
Yes.
So, thanks a lot already for this fruitful discussions. For what we learned is the most important, the coffee break and talking over coffee, which we would like to continue. So, what will happen tonight is that we will meet at the Beer Museum. I think we can, what time is it? Can we start right away? A 9:15. So when we start now slowly, we could go together there. They're expecting us at 6 p.m. for a tour. So those of you not knowing the Munich Oktoberfest and Beer Museum, they will enjoy a lot the tour. Those of you who took it, I think we had it sometimes in our summer schools. Well, it might be nice to repeat the tour. And then they are waiting us with dinner starting from 7 p.m. Okay, so I think we have a pre-selection of a dinner. I hope that there is something for everybody. And I forgot something. For tomorrow.
Yes. So tomorrow I would like to let you know that we are not going to come here because we are going to have a new venue for tomorrow and for Friday. But there is going to be one student there in the hotel, so waiting for you. So please, he's going to be there at 8 a.m. So they can come together with him to the new venue. It's going to be in the Kunstler house that is in the station Karplatz, Stachus. but he is going to be there in the hotel, so he can come with you and guide you to the new venue. And we are going to stay there for tomorrow and for Friday.
Thank you. So it's not too far, and it's nice and everything. So yes, so I think, and it's from the size, it's perfect for the size of this group. So that's why we had to move outside the hospital and allowing you to find really something which is suitable for a workshop type of venue which we would like to have. So thank you. Yes, I also wanted to introduce you to this CIH office team, which I think not all of you have met, but could you call them in maybe, because we have time, so that you know who are the ones facilitating everything. Unfortunately, Christina, who was starting the organization, was sick, so she couldn't continue this. So yes, but gratefully, we not only have Christina in the office, and maybe while the others are entering, you all know Veronica. I think she has been with us since 2009, and she was the one saying, yes, I can help you with the organization of the event, and as she knows everything about us and the events, this was very happy. Thank you, Veronica. I already presented Isabel. She is here to help you with the reimbursement and everything. And I'm not sure whether all of you already met my others, also from the CIH office, at the same time, PhD student at the Rachel Carson Center, especially in nutrition, if I'm not mistaken, right? And she is doing her PhD at another Exceed Center in Hohenheim. So you see how important also the collaboration between Exceed Center is. And then Talita is the one thanks to whom we now have a much nicer newsletter, if I may say so, helping with all the social media things and so on, and also was here creating nice things like the video, which also includes your posters and so on. Talita is also a PhD student at the Rachel Carson Center with a background in urban development architecture. So again, important aspects for the work for the One Health work, and both of them are also involved in the development of the e-models. You know Bernardo, like the coordinator of the e-learning in Latin America, not at the CIH office, but in my group of it. Then we have Baruka, why are you hiding? We have Baruka, who has done many things, run around, made things run smoothly, and also took good care to find the excellent venue for tomorrow. And Benedict, who is the one selecting the catering for today, for example, and is also very good and finances renewing memberships of CIH and so on. So that's Benedict. So you know the team, those of you taking care of you, whom you could ask also over these things. Thank you. So, take some food for the right lady.